Inside a paramedic's kit, you'll find all sorts of high-tech gadgets and really complex drugs. But what if I told you that one of the most powerful, life-saving tools they have isn't a device at all? It's actually just a simple sugar, one that can literally reverse a coma in a matter of minutes. Today, we're diving deep into dextrose.
Okay, so put yourself in this situation. You're the first person on the scene. Someone is unconscious, unresponsive, and the clock is ticking. What if there was one single thing you could do that could potentially wake them up, completely reverse their condition in just 60 seconds? It sounds like something out of a movie, right? Well, it's not.
So here's our game plan. We're going to start with the problem, a patient in a coma where nobody knows why. Then we'll meet our hero, dextrose, and understand what it actually is. After that, we'll get into the nitty-gritty of when and how to use it, cover the very real risks, and then we'll wrap it all up.
All right, first up, the paramedic's dilemma. They arrive on scene and they're faced with a complete mystery. See, when a paramedic finds someone unconscious, their mind is racing through a whole list of possibilities. Could it be a stroke, a seizure, maybe a head injury nobody saw, or even a drug overdose? All of those things are incredibly serious and need a hospital. But then there's another possibility on that list, hypoglycemia, which is just a fancy way of saying dangerously low blood sugar. And that one has a simple and incredibly fast fix.
In that direct countermeasure, the perfect weapon against hypoglycemia is dextrose. It's basically pure fuel for the body.
So what is dextrose, really? Well, chemically, it's D-glucose, but let's break that down. Just think of it as the most basic, most essential type of fuel that every single cell in your body runs on. Your brain especially is a total energy hog. It devours glucose. Without it, the lights go out, fast.
And here's the part that's just mind-blowing. When dextrose is given through an IV, the onset time is just 1 minute. I mean, think about that. In an emergency where every single second can mean the difference between a full recovery and permanent brain damage, being able to reverse a coma in 60 seconds is, well, it's incredible.
So why is it so ridiculously fast? Well, when you eat a candy bar, your body has to go through the whole process of digestion to break it down and get the sugar into your blood. IV dextrose just skips all of that. It's like pouring high-octane rocket fuel directly into your body's engine. The brain gets exactly what it was screaming for, and it gets it instantly.
Okay, so we know it's fast and we know it's fuel, but when do paramedics actually use it and how do they do it? Let's open up the emergency toolkit.
Now, paramedics don't just hand this stuff out to everyone. There are very specific reasons or indications to use it. The most obvious one is, of course, hypoglycemia. Either they've tested the blood sugar and it's low, or they just strongly suspect it is. But it's also a go-to treatment for anyone with an altered mental status, a coma, or even a seizure if the cause isn't immediately clear.
And the process itself requires a ton of care and precision. First, if they can, they'll draw a quick blood sample to get an exact glucose number. Second, and this is absolutely crucial, they have to make sure the IV line is in a big, healthy vein that won't blow. We'll see why in a second. And finally, they push the dextrose in slowly, watching the patient the entire time, just waiting for that amazing moment when they start to wake up.
And the dose is definitely not one size fits all. It's all carefully calculated. An adult might get a full 25 grams, but for kids, and especially for tiny infants and newborns, the dose is much, much smaller, and based on their exact weight. You'll also see here that a less concentrated 10% solution is often preferred because it's a bit gentler on the veins.
But, and this is a really important but, this incredibly powerful tool also comes with some serious dangers. There are critical red flags that every single first responder needs to know about. Yeah, the biggest challenge is knowing when not to use it. For example, if a patient is having a stroke, but their blood sugar is normal, flooding their system with sugar can actually make the brain injury worse. Same thing if there's any sign of bleeding or high pressure inside their skull. This is a massive, high-stakes decision that paramedics have to make in just a few seconds.
And even when it's the right call, things can still go wrong. It's common for patients to feel a burning sensation at the IV site. But what's really dangerous is that concentrated dextrose is super harsh on body tissue. If that IV isn't perfectly in the vein and the solution leaks out, it's a problem called extravasation. It can cause horrible damage, even killing the tissue. That's why getting a good, solid IV line is non-negotiable.
Now, check out this quote from a clinical protocol. I think this is so fascinating because it shows you just how urgent this is.
There's this little-known medical concern about giving glucose to people who might be deficient in a vitamin called thiamine. But the official guidance is crystal clear. You never delay giving glucose to a hypoglycemic patient, ever. The danger from low blood sugar is right now. It's immediate, and it's catastrophic. Everything else can wait.
Okay, so let's tie this all together and talk about the final word on the amazing power of this simple sugar.
Here's the bottom line. Dextrose is just beautiful in its simplicity. You know, in a world of really complicated medicine, here we have one of the basic building blocks of life being used as this direct, incredibly powerful tool. It takes a situation that could easily end in tragedy and more often than not, completely turns it around in about the time it takes you to make a cup of coffee. And that kind of leaves us with a final thought, doesn't it? Dextrose is, at the end of the day, just a form of sugar, something we see and use every single day. It really makes you wonder, what other totally ordinary, everyday substances are out there, just hiding in plain sight, waiting for us to figure out their extraordinary life-saving potential? Thanks for exploring this with us.